Heart attacks in women often present symptoms that can be confused with anxiety, leading to misdiagnosis and delayed treatment. Women may experience symptoms like chest discomfort and palpitations, which are common in both conditions, but they also report subtler signs such as unusual fatigue, shortness of breath, and nausea. Anxiety, on the other hand, often manifests with symptoms like rapid heartbeat, chest tightness, and shortness of breath, which overlap with those of a heart attack. Treatment for a heart attack typically requires immediate emergency care, including medications and surgical interventions, whereas anxiety is managed through lifestyle changes, therapy, and medication. Risk factors for heart attacks include age, high blood pressure, smoking, diabetes, and family history. But stress and anxiety can exacerbate these risks. Here, we delve into the nuanced aspects of diagnosing and treating heart attacks in women while distinguishing them from symptoms of anxiety. Symptom manifestation: chest pain versus psychological distress. Women's heart attack symptoms often differ from men's and can be confused with anxiety. Chest pain is a classic sign, but women might experience it differently, sometimes feeling a pressure or tightness rather than sharp pain. It can easily be misinterpreted as anxiety or panic attack, since both conditions can cause similar sensations. Furthermore, women may present with more subtle symptoms such as shortness of breath, nausea, fatigue, and dizziness, which overlap with anxiety symptoms. This diagnostic challenge emphasizes the need for heightened awareness and careful assessment of these symptoms in women, as misinterpreting a heart attack for anxiety could have fatal consequences. Understanding gender-specific presentations of heart disease is crucial for timely and accurate diagnosis. Onset pattern: sudden and acute versus gradual or variable. Women's heart attack symptoms often overlap with those of anxiety, complicating diagnosis. While anxiety symptoms can build up gradually or vary in intensity over time, a heart attack in women can present with a sudden and acute onset of symptoms. However, it is not uncommon for women to experience subtler or atypical heart attack symptoms compared to men, like shortness of breath, nausea, back or jaw pain, which can mimic anxiety. Unlike anxiety attacks that may be triggered by stressors and can improve with relaxation techniques, heart attack symptoms persist and intensify, especially with physical exertion, and require immediate medical attention. Recognizing these patterns is vital, as misdiagnosis can have life-threatening consequences. Associated symptoms: shortness of breath versus panic. Women experiencing a heart attack may present with atypical symptoms when compared to men, making it challenging to differentiate from an anxiety or panic attack. These symptoms can include shortness of breath, nausea, fatigue, dizziness, and discomfort in the chest, neck, jaw, or back. Unlike anxiety, which often has a rapid onset associated with triggers and is accompanied by intense fear or apprehension, heart attack symptoms tend to develop gradually and persist regardless of the situation. Notably, during a heart attack, shortness of breath typically arises without the intense psychological distress characteristic of panic attacks. Furthermore, heart attack-associated discomfort generally does not resolve with relaxation techniques effective for anxiety. Recognizing the nuanced differences in symptoms between these conditions is crucial, as timely intervention can be life-saving in the context of a heart attack. Triggers: physical exertion versus stressful situations. Women often experience heart attack symptoms that are subtler compared to men, sometimes resembling anxiety. While both conditions may present with chest discomfort, heart attack symptoms in women often include shortness of breath, fatigue, and nausea, potentially mistaken for panic attacks, which show similar manifestations. However, a key differentiator can be triggers. Physical exertion often provokes heart attack symptoms, as the heart requires more oxygen during activity. On the contrary, anxiety symptoms typically arise in response to stressful situations and may include hyperventilation and intense fear. Distinguishing between these can be critical, as mistaking a heart attack for anxiety could delay life-saving interventions. Risk factors: cardiovascular profile versus mental health history. Differentiating between women's heart attack symptoms and anxiety is crucial, since both can present with chest discomfort, palpitations, shortness of breath, and sweating. In women, heart attack symptoms can be atypical, such as fatigue, nausea, or back jaw pain, often mistaken for anxiety. Evaluating risk factors enhances accuracy in differential diagnosis. A cardiovascular profile includes hypertension, diabetes, high cholesterol, smoking, and family history of heart disease. A mental health history explores chronic stress, panic disorder, and generalized anxiety disorder. While anxiety induced symptoms typically occur in stressful situations, cardiac events may arise spontaneously or with physical exertion, underlining the importance of considering both the patient's psychological and cardiovascular risk profiles.